Hello, my name is Catherine Taylor Chuang. I'm a family physician and a recent MPH graduate. I will be presenting this poster on behalf of Rosemary Costa Wright and her research team from Chiricahua Community Health Centers in collaboration with the U of A. The purpose of this study is to assess whether patients in 2 federally qualified health centers, or FQHCs, in Arizona were satisfied with their experience with telemedicine. Given that these FQHCs provided care to underserved populations, telemedicine may be a viable option for those faced with healthcare access barriers, helping reduce the health equity gap. Chiricahua Community Health Centers is a network of 12 rural clinics and serves over 28,000 patients. They conducted over 60,000 telemedicine visits between March 2020 and June 2021. Neighborhood Outreach Access to Health, or NOAA, is a network of 9 FQHCs within the Phoenix metro area and conducted over 75,000 telemedicine visits during the same time period. Between February and July of 2021, research associates invited patients to complete a telemedicine satisfaction survey via phone call. All patients 18 and older who had at least one visit since November of 2020 were eligible to participate. Pediatric patients had their own parents complete the survey on their behalf. A 15-question survey was administered to participants over the phone. A 5-point Likert scale ranging from very satisfied to very dissatisfied was employed for each question. A total of 165 participant responses were recorded. More than half of patients stated that their experience with telemedicine and traditional visits were similar, while 26.1% of patients stated that telemedicine was better than a traditional visit. When asked about what aspect of telemedicine they liked most, half of the participants responded that they liked the distance, convenience, or less travel. This aspect reflects the challenges many rural communities face when trying to access healthcare. Most patients who had at least one visit reported being overall satisfied with telemedicine. When asked about preferred appointment modality in the future, 32% preferred traditional in-person visits, while 21.6% preferred telemedicine. The remaining percentage had no preference. Challenges were faced in this study, including recruitment of Arizona FQHCs and the methods used to collect data. Among the 23 Arizona FQHCs, only 2 proceeded with the study participation. In addition to the lack of FQHC participation, the methods used to collect data was not ideal. U of A students collected data over the phone. It is time-consuming, and after months of minimal participant engagement, a sufficient number of surveys was not collected for robust data analysis. Despite the challenges, telemedicine can be a valuable asset to the FQHC world, as these centers often serve vulnerable populations who struggle with access to care. This study showed that most participants were satisfied with telemedicine overall, indicating this modality is a feasible alternative, which is a step in reducing the health equity gap. Thank you for listening.